Good morning, everyone. My name's Jenny Preston. I'm from the University of Liverpool in the UK, and we're going to talk about children and young patients and family involvement, the why and the how. So, as I said, and my colleagues will introduce themselves in a minute, but so I've been based in the UK now, working in the UK, I should say, at the University of Liverpool for 15 years, working with children and young people and families in the design of clinical trials. I'm also part of C4C and have been for the last few years, working alongside Begonia and the wider team. I'll now hand you over to Begonia, and then Aislinn can introduce herself.
Hello, good morning to everybody. It's my pleasure to be with all of you today. As Jenny Preston mentioned, we are working together for many years in the field of the engagement of young people in the development of clinical trials. I'm working in San Joan de Déu Research Foundation. This is the largest pediatric hospital in Spain, and we work in European collaborative projects such as the Connect for Children. Thank you. Aislinn, your time.
Oh, sorry, everyone. I had myself muted. Hi, everyone. I'm Aisling Walsh, and I'm a Senior Project Manager for Maternal and Newborn Health for the European Foundation for the Care of Newborn Infants. And I've joined EFCNI quite recently in June, but I've many years experience implementing EU and international research projects, and particularly focusing on engagement issues. So I look forward to introducing EFCNI a little bit later in the presentation. So I'll hand you back over now to Jen.
Thank you. Next slide, please. So hopefully you would have all received the pre-reading material in advance, and the first paper, and it wasn't just to plug my paper, but it was just a nice example of how young people have been involved in different stages of the research process and the impact it can make to clinical trials in children. And then the case study is for discussion later on in an activity that we've planned, just to give it a practical example of what some of the trials that we see and how our young people can have an input into that. So the next slide, please. So this we thought was a good photograph and quote to capture how clinical trials are designed and often how patients are overlooked. So we spend a lot of time designing studies, but not enough time thinking about the patients and the families and the impact it might have for them to participate in studies. And that's why it's really important we devote a lot of our time to making sure that our children and young people and families are involved in those processes. So next slide, please. So we've seen advances in paediatric research across the globe to improve the lives of babies, children and adolescents, which have dramatically reduced rates in morbidity and mortality and increased the quality of life worldwide through research, such as reducing sudden infant death with the Back to Sleep campaign, and increasing the life expectancy for children and with sickle cell anemia and cystic fibrosis, for example. And they're just several of the diseases that we've seen a dramatic increase in life expectancy. Next slide, please. However, despite these advances, current data suggests that 50% of children's medicines used across Europe are either unlicensed or off-label, and this rises to 90% in neonates. This means that the majority of medicines are not available in a pharmaceutical form suitable for children, resulting in the risk of inefficacy. Sorry, some of the words I used this morning, I'm getting all muddled up, sorry. And or adverse reactions in children, which I think most of you would understand. Next slide. However, the introduction of the paediatric regulation in 2006 and the establishment of paediatric research networks has resulted in the increase in clinical trials to ensure the safety and efficacy of medicinal products. which has resulted in the steady rise of clinical trials in children, as you can see from the bar chart. And this is rising on a yearly basis as we speak. The next slide, please. However, we've got, challenges still remain. So let's take these statistics, for instance, taken in the UK of over 2,000 adults surveyed. 58% still thought that children are not allowed to participate in clinical trials, which is quite shocking, really. So despite efforts, the requirement for further awareness and education is needed. Not only is there a lack of awareness about paediatric clinical trials and trials in general, other challenges include access to trials, recruitment and retention. But we feel that we have a solution to tackle these issues, and that's by encouraging the involvement of children and young people and their families throughout the research pathway. Next slide, please. And this involvement and increased awareness of paediatric clinical trials may overcome some of the challenges that we face, such as the recruitment. So we've got delayed recruitment to patient to recruitment in trials, which is 50%. And then the biggest problem that we have is the failing to retain enough patients. And that's due to, partly due to some of the information that patients and families receive in advance of the clinical trial proceeding, or due to the lack of understanding of when participants actually consent or assent to take part in the study. So next slide, please. So we again feel that involvement is absolutely crucial to avoid these issues. But when we talk about involvement, we mean creating an active partnership between young people and families, healthcare professionals, and life science industries in the design and conduct of the research, so that it's relevant to the child and appropriate for the family. Next slide. But some of you might have heard different terminology being used for involvement, and this could be engagement, which we tend to think of as sharing information and knowledge and how that's disseminated, or participation, where people can take part in a research study. But most of the time, all of these words can overlap, but means the same thing. So it's about being clear about what that actually means when asked to participate. Next slide, please. So we're going to just talk about very briefly about why involving children and young people in clinical trials and why that's important. So in the literature, there's three main arguments for why children and young people are invited to take part in research. And firstly is that patients have a moral right to be involved in decisions that may affect their health and their lives, and that includes young people. And with the introduction of the United Nations Convention of the Rights of the Child, young people have a right to participate in decisions that affect them. So we feel health and health research is absolutely crucial that they have a voice in this. There's also the democratic process, so that all stakeholders have a voice. And then thirdly is it can improve the quality of research and enhance recruitment and retention in trials, for example. But more importantly, it improves the practical aspects of study participation. Next slide. So as I've said, the biggest problem that we have is that we have a lot of recruitment and retention issues, but this is partly because 75% of medical procedures can aid the decision to participate. So it's really important that we get that right with the involvement of the patients. But to avoid the retention issue and to reduce amendments being made to ethics committees, for example, it's so crucial to have the patient voice right the way throughout the pathway. Next slide, please. So most of you might have seen this in some format, but we advocate that patient involvement should be from right from the priority setting to the conception of the research, right the way through to the dissemination and the communication of the research findings. And this can be achieved in many ways. So whether that's patients sitting on a trial steering committee, for example, or young people's involvement through young persons advisory groups, which we'll talk about a little bit more in the how section shortly. So now we're going to hand you over to Begonia, who's going to talk about how we, our experiences of how we've involved, but and some of the other methods that we can do to involve children and families in the research process.
Mm-hmm. Perfect. Thank you. Thank you very much, Jenny. And thank you to offer an overview about why it's important to involve children and young people in clinical trials. I like this metaphor about the bridge, because this is what is it, but in other kind of fields or industries, always know the customers, the clients, or the people for those our services are addressed as part of the process. But still in the field of research, it's quite new. And regarding pediatrics, it's something that still it's not very well implemented. And the aim of the PPI team in C4C is to try to ensure that any trial in this network can have this model, ensuring that we are ready to facilitate and involve the patient's involvement. And this is something that it's feasible, because when we talk about the how, sometimes when we speak in conferences or with other colleagues, the first thought that these people have on mind is that we are talking about science fiction, involve children, young people, or parents. And this is something that is working. Jenny has a lot of experience, and there are many other pediatric hospitals doing the same model. There are many patients organizations, but the problem that we have is that it's not part of the process. The ethical submission, it's mandatory, but for example, have early discussions with patients or other activities along this pathway still is something that it's not mandatory or very well established. This is our aim, and this is the main idea of the C4C PPI team, to ensure that we are ready, that we can demonstrate that this can work and has a lot of benefits for the project, but obviously for the patients. The data that already Jenny introduced come from publications related to the adult setting. We will send to all of you the references, but when we move to pediatrics, still we don't have the references or this data. And we envision that probably are more dramatic, the problems that we have of retention, recruitment, etc. Let's move to answer this question about how to involve patients in pediatric clinical trials. The first thing that we need to have in mind is the patient. Again, the metaphor of the bridge, again, the patient. Patient needs to be in the center, and it's the pillar of our work. Even if we are here on behalf of industry, that it's an important stakeholder, or academia, even if we are in the field of representing an ethics committee, in any case, for any stakeholder, the thought that we need to have is always the patient. When we talk about pediatric patients, we need to consider many things, and I'm very glad that in this training we are going to work in deep of all these aspects. The first one is that historically the pediatric population has been considered a vulnerable group. You know that in the first clinical trials in the history were focused in adults and in some specific groups, but usually kids and pregnant women have been excluded for the risk to experiment new treatments with them. But also we know, and all the people that it's online, that we have many diseases that are only pediatrics. We need to develop specific projects for the pediatric patients. The second point that we need to have in mind is the ethics principles. We have learned a lot along the history about things that have been to be corrected or improved. We are going to have a very funny, if I can use this word, activity today, working in the field of ethics, but also this is one perspective that we need to have always in mind when we work with pediatric patients, and obviously also with any other kind of patients. The risk and benefit, we need to educate and inform the patients that are involved in any activity to have this critical perspective in terms to analyze what it means for a real patient to participate in a clinical trial, because also in some of these pediatric conditions, we don't have already a treatment. And it means that a clinical trial is the only opportunity that we are offering to patients. And this analysis of the risk benefit, it's for us mandatory and to educate in this ethical and critical thinking. And obviously, as Jenny mentioned, the rights of the children. They have the right to be heard, they have the right to access to a good quality healthcare and stay healthy, and obviously the right to access to research, because it's the only way to access and to have better medicines for children. Next slide. When we talk about pediatric patients, in fact, we are not having only one picture. We have a big picture from the preterm newborns until the adolescents. And this a different vision of the patients, because the adolescents, they can have no maturity to think and participate. It depends on the disease, but probably the newborns, the infants and the toddlers or the children, sometimes they are not, for many things that we will see afterwards, they cannot be involved. In this sense, if we move to the next slide, when we think about the pediatric patients, we need to have in our mind the idea of the family, because never a pediatric patient, even if it's an adolescent, it's involved individually in a trial. He or she needs to take decisions with their parents or the legal guardian, and at the end, it's an experience that affects the whole family. In this sense, I said, put always the patient in the center, but when we talk about pediatrics, at the end, it's the family who is there and for who will work. Next slide. What does mean the fact to involve pediatric patients in clinical trials? It's a very diverse reality. We need to consider that we have, as I said, different ages of patients, different conditions. In some cases, even if they are teenagers, they cannot participate directly because probably they have a cognitive impairment or any other issue that cannot make feasible their direct involvement. Another important point that we need to consider in the European context is that something that it's mandatory, that it's to have the voice of the children in the consent process. Regarding the age point of view, it's different in every European country. And this is something that when we work collaborative in projects with different countries, we need to have on mind. As I said, it's very important the role of the family, and we need to consider the role of the parents or legal guardians. And in some studies, they will be the ones to be involved. And one other important point is in any discussion, patient involvement activity in which we involve the patients, we need to consider the context about this study. And in some cases, as I said, we don't have an approved treatment, and the clinical trial is the unique and the only opportunity that we have. And also a big important discussion is when these trials include a placebo arm. These are, in general, many things that we need to consider when we involve patients in clinical trials. Next slide. How? Things that we need to consider. Obviously, the how it's the fact to have a very participatory activity with patients, and this participatory activity with patients can have different formats. From the traditional one that it's very well implemented, and it's very common that it's a questionnaire or a survey, that from our experience with Jenny and other colleagues, we don't like so much because it's not very wealthy. Sometimes it's a question and a closed list of answer. Creativity or discussion, it's not feasible there. Our point is try to choose the best methodology according with the question of your activity. If you have, for example, an activity to discuss about the design of a protocol, probably it's better a panel or another kind of activity that at the end you can gather the feedback of all the participants, and a detailed feedback that can facilitate to guess and identify improvements in this protocol. If we design a survey or a questionnaire, probably the options are there and there is no opportunity to adjust or change or add new comments in this list of questions. Every project is different from all these points that I have mentioned, from the age of the trial, from the country perspective, from the culture of the patients, from the design, from the protocol, because there are studies that are very, very complex or require a very very dramatic change in the life of the patients. We need to have on mind all these aspects. And one advice that we want to bring to all of you anytime that you design or develop activities to involve the patients, it's take your time to design the activity, to discuss, and execute the activity, but important, evaluate the activity, because at the end, these are the outcomes that are going to make changes in this project. And this is very important. And the impact, we need to have this wider view that it's sometimes quantitative, because we have shown to all of you numbers, but the qualitative part is very important. And I said, put the patient and the family in the center, and the quality of life of the patients, because these are voluntary people. They don't know at the end if the study is going to be successful or not, if the drug is going to be in the market, and they are donating time of their life, and sometimes it's years. And it's very important to evaluate the impact in terms to improve the project, and have always on mind the quality of life of the patients. Next slide. What we need to ensure in this process: transparency and objectivity. It's very important that the ones that are designing this activity don't have a direct connection or activity in the project. This is very, very important. Have this long distance view. Consider the special needs of the patients or the family. The means to involve the patients. Some patients have special needs and they need specific tools, but in the present moment that in which we are living, that basically we are not sometimes allowed to have these face-to-face activities, we are using digital tools. We need to be sure that all the participants in any kind of PPI activity can use these tools, and before this, obviously, have access to these tools. Again, the importance to have this alignment and to consider the ethics principles and the rights of the children. The conflict of interest. Patients need to be informed that if they are participating in a PPI activity, probably in a close future they cannot participate in another PPI activity of the same trial, for example, from the regulatory point of view. This is another right, the access to information, and patients, they need to know. The compensation and the reimbursement. It's a lot of time and effort from the patients and the families there. The methodology, it's a key point for the success of the activity. And in any case, ask for advice of the experts. And the experts obviously are in the PPI field, but also are the clinicians and other researchers that are involved in the projects. Try to build a big team of different experts to move forward with any project and activity of PPI. Next slide. Methodology. I have highlighted the importance to choose the best methodology. I'm not going to go in deep here, because I know that we have very well experienced people today in this workshop, but my main message here is think in big, and try to improve and test new methodologies according with the answer of your activity. We have plenty of different methodologies. You can see here in the slide: focus groups, questionnaires, interviews, patient journeys, simulations, advisory boards, the involvement in steering committees. There are plenty of activities, but take your time to think which is the best one, and obviously ask for people that can have experience facilitating this activity with children, young people, or parents in this case. This is very, very important. And also the format. Traditionally, we did these activities in a face-to-face format. Now we are moving to this virtual format, but probably in the future, we are going to mix and we are going to have a blended methodology. One thing that I want to highlight is that from our perspective, it's important to involve the patients along the whole process, as Jenny said. Obviously, a key moment is when we are discussing about the needs of the patients, about the protocol design, because this is the first and big step. But for us, it's mandatory to ensure that the patients are around, and until the last moment when we need to disseminate the outcomes of the project. And along this big journey, probably you can have different of these methodologies implemented, but also different formats. It's only to offer to all of you different options. Next slide. How we are working in the C4C project to ensure that the voice of the patients it's in any project according with the needs that we receive from the different sponsors, commercial or academic sponsors. We have a model that is summarized in this slide. that I'm going to explain to all of you. And it's for us very, very important that you know this model, and obviously to have you on board to make feasible this model, because behind the access to a patient, always there is a patient organization or any other umbrella organization that at the end are the ones that needs to work with us as a team and make feasible this model. How it works. You can see here that we receive a request from a sponsor. This is centralized in this name that means single point of contact. Thank you, Maria, for helping me with the acronyms. We gather all this information in a template, asking about in which part of the process do you want to involve the patients, how many countries, the disease, obviously, the age of the patient, many features that help us to identify the right patients to be involved. You can see here that if we have a patient in a database of experts that already it's implemented in the C4C website, it's quite easy and fast, the process to select the patients. If we don't have a patient or a pool of patients identified in this database, it's when we liaise with the POs, patients organizations, and the umbrella organizations. This is the process that we use to follow to select the right patients. Obviously, in parallel, we are working in the design of the activity, and we have plenty of meetings with the sponsor to have this good design that I have mentioned, with the good methodology and the format. Obviously, there are administrative staff behind the process to involve a patient, about contracts, CDI, agreements, etc. And when all this stuff is done, we are ready to execute this activity. This activity can have these different formats, but in any case, always the outcome is a final report, a final document that we send to the sponsor, but also help to the team of PPI in the C4C to analyze and to assess something that I have mentioned that it's very important, which is the impact of the activity already done with the patients. This is the process that we follow. If we move to the next slide. To summarize, we can deliver in C4C activities in the early phases, even in the awareness about the importance and the need to involve patients in the field of pediatric clinical trials, in the design phase, recruitment, consent, and obviously in the feedback. As I said, for us, every wins when we put the patients first. Next slide. Also, we have in the C4C, beyond this strong and close collaboration with the patients' organizations, we have a national infrastructure of pediatric clinical trials sites. Every country that is represented in the C4C has their own national hub, and also it's there a person with experience in PPI to ensure and support any activity. And this is another way that we have to recruit patients. I have mentioned the patients' organizations and the umbrella organizations, but obviously there are the pediatric clinical trial sites that they have access to the patients, because not always there is a patient organization working in some countries for the most ultra rare conditions or according to the needs that we can have in a project. It's another opportunity to help and involve the patients. Next slide. The patient expert database that already I have mentioned, it's working in the C4C website. You have here the link to access. For me, one home take message that I of a young person's advisory group, also you can be part of the database. We are going to be very glad if all of you contribute to this database, because this makes more fast the process that I have mentioned to all of you. Next slide. We have here a short video that summarizes probably better than my explanation how the C4C is working with patients.
Babies, children, and young people need better medicines, and research is essential to improve their health.
Is working or no?
Yes, it's working.
Yeah, it's working.
Yeah,
Okay.
sound,
Well-being,
image, everything.
and the care they receive. The parents, as well as children and young adults, can advise why and how this research should be done. Researchers know that young patients or their representatives' opinion is important. However, it is still difficult to involve them in the design of research. C4C plans to help researchers to do that. C4C is a European network, including clinicians, pharma companies, clinical research experts, aiming at improving paediatric clinical research. As listening to the voice of children, young people and their families is a central part of this project, C4C researchers aim to work with patients and healthy people, asking their opinions and using their ideas to improve research. To do this, in C4C we are creating a database of people interested in paediatric diseases, young patients, families, groups and associations to let them work together. If you sign up to this database, you can be contacted to participate in many activities within the C4C project. You will have the opportunity to collaborate with researchers who will listen to your suggestions to do research, taking into account patients' needs. You will also help to create informative materials for young patients joining C4C clinical trials and to share the results of the research. Do you feel that you don't know enough about research to take part in C4C? Don't worry. Before you participate, we will give you all the information that you need. At C4C, we're working to give a voice to children, young people and families in research. And you have much to say. Help us do better research and develop better medicines for children.
Let's move to the next part with my colleague Ashley. Thank you very much.
Okay, hi everyone. I'm just going to give you a quick overview. This part will mainly involve an introduction to who we are as EFCNI and an overview of the ongoing feasibility trials that are part of the C4C project. I will briefly say a few words on PPI involvement with the TRAIL Kappa trial. And I see that today Jacob from the Casper CEF trial is with us, so he will say a few words on the PPI activities associated with that trial. So just a few words first of all on who we are. So as I mentioned before, I'm a senior project manager for maternal and newborn health with the European Foundation for the Care of Newborn Infants, and EFCNI, as the abbreviation is known, is the first pan-European organisation to represent the interests of preterm and ill newborn infants and their families. And the organisation has been in existence since 2008, and this was mainly because of the experience of our founder, Silke Mader. So she had twins at 26 weeks, one of which unfortunately passed away a week after birth, and the surviving twin then is now an adult. But his life has not been without difficulties and without illness. And Silke's experience during her birth of the twins and the involvement of the patient in the process during after birth and with follow-up care, she felt was lacking, and hence the motivation to set up EFCNI and really explore this topic of patient and parent involvement, and also advocate for better healthcare and better conditions for preterm babies and their families. So what we do as an organisation is that we combine the forces of parents, healthcare professionals, scientists, and work together to reduce preterm birth rates and to improve outcomes for surviving babies and their families. And we have three main fields of activities: preconception and maternal care, treatment and care during and after birth, and continuing care and follow-up throughout the life of the preterm born child. And we have strong partnerships with over 100 parent organisations worldwide. We also have partnerships and a wide network with global healthcare societies, European healthcare societies, and national healthcare societies. We also work with supranational organisations, the World Health Organization, the UN. We work with the EU institutions, the Parliament, the Commission. We have one of our big projects is the European Standards of Care. So in this project, we're really trying to standardise care of preterm born infants across Europe. And we've also been involved in the preparation of some G7 meetings that focus on neonatal issues. So in regards to the C4C project, we are a third party in the C4C project, and we are taking care of PPI activities for the Trio Kappa clinical trial. So the official title of the trial is Prophylactic Treatment of the Ductus Arteriosus in Preterm Infants by an acetaminophen. And that fancy word is basically a fancy word for paracetamol. The ductus arteriosus, just to give a brief explanation, when the fetus is in the mother's womb, it gets its oxygen from the placenta, and this ductus arteriosus is a blood vessel that takes the blood away from the fetus's lungs so that the lungs can develop properly. And when the infant is born, it starts to breathe on its own. And in normal full-term born infants, this blood vessel will close by itself. But in preterm born infants, this is often not the case, and the blood vessel is left open, which can cause heart issues and other issues in the preterm born infant. So this trial really is looking into using paracetamol, which has already preliminarily shown to have fewer adverse effects on the infant than other methods, other drugs that have been used. And the study is coordinated by INSERM in France and led by Nantes University. And it's a phase 2 and 3 European multi-center double-blind randomized trial running in 66 sites in 17 European countries. And phase 2 of the trial really is trying to find the minimum effective dose, which will work to close this blood vessel in infants of a gestational age less than 27 weeks. And in this phase 2, we will look at a sample size of a maximum of 30 patients at varying gestational ages, starting from 23 to 24 weeks, then 25, and then 26 weeks. And then in the third phase of the trial, this is a placebo-controlled superiority trial of 548 infants who have a gestational age of more than 27 weeks. And here we're looking at really increasing survival without morbidity or adverse effects, increasing that number from 50% to 62%. So a little word about EFCNI's involvement in the trial. So as I said before, we would be responsible for the PPI activities, and these have not started not that long ago. The trial will run for 4 years. And a major part of that has been so far the setup of the Parent Advisory Board. So we have 5 members selected already of the Parent Advisory Board for Trio Kappa, and we will manage this board and communication with the board on all aspects of the trial. We will also coordinate with the C4C PPI team and report to them on PPI activities within the trial. We will also liaise with the study team on creation of information material, and then also because of our strong networks, we would also do some research into further patient and parent groups for the trial, and also coordinate where applicable with these groups. Then we will also, in collaboration with the Parent Advisory Board, we will also provide input on the trial materials. What has already been done, we have already provided some input on the ethics proposal for the trial. We have provided input for the study design and protocol. And this will continue for all other relevant trial materials through the course of the trial. So for example, in the making, we have some educational videos, a questionnaire on pain and comfort in the neonatal intensive care units. And this is particularly, let's say, I think this is one of the most challenging aspects that we will face concerning PPI involvement during this trial. As you know, most parents whose child is born preterm, it's a very unexpected event. So they don't necessarily have the time to follow and understand what it means to enroll a preterm born baby in such a trial. So this communication before the enrollment of the child in trial is crucial and really important to get right, because it's a very vulnerable time in a parent's life. So I think this is one of the main challenges that we will face in terms of how to approach this in terms of training of medical staff, educating them on the right kind of questions to ask, the right kind of information to give that's also understandable to people in such a vulnerable moment of their life. We have also already provided input for the consent form and the patient information sheet. And then after the patients have been enrolled, we will also then be involved in the development of an e-tool to perform follow-up of the trial. So here we really want to be involved in how to design this tool so that patient involvement really is at the forefront. And this, as a basic element, would include user-friendliness and how to use the tool, as well as understand what's expected of the parents in terms of input, because then this will also ensure their commitment to the follow-up or in the follow-up process. We're also involved in the steering committee meetings at least once a year, if not twice a year. And then we also review documents concerning the steering committee meetings. The last element then in the PPI activities would be outreach and dissemination, which I think many of you have been involved in yourselves, so you probably know very well that this would involve then the drafting and development of a communication strategy, which we have a rough outline of so far for the Trail Kappa trial, which still needs some work. That will then inform how we disseminate information on the trial throughout social media and also identify key stakeholders, so who would be interested in hearing this message about this particular type of trial, and then dissemination of the results, so that would really be making them again clear and user-friendly to the patient and parent community, and not only the patient and parent community, also to policymakers and the general public, so that there really is a more general interest in the outcomes of these types of trials. So that was it really briefly on EFC&I's involvement within Trail Kappa. So now I think I'll pass over to Jacob to say a few words on the other C4C feasibility trial, Casper CF.
Hi, thank you very much. Thank you for having me. Good morning. Yes, so my name's Jacob. I head up the PPI element for the Casper CF trial, and the overall aim of the Casper CF trial is to find the right dose of posaconazole, which is an antifungal drug that treats aspergillus for children and young people with cystic fibrosis. Yeah, we're coordinated by the University of Exeter. I work for the University of Exeter, but we have 35 sites across 12 European countries, and also liaise with a number of other academic and medical organisations across Europe to achieve that. In the aim of our trial, we'll hopefully screen 1,500 children and young people looking for signs of aspergillus, and then we will then take those forward to the intervention stage to then allocate them to either a treatment or a control arm. And within that control arm, half will receive no treatment, and then oh, my apologies, so 1/3 will receive no treatment, and then 2/3 will we will treat for posaconazole. And as I'm sure you're aware, these proof of viability studies, we're looking at to see dosage, but also looking to see are these safe to use in children, which is great. Next slide, please. Thank you. So PPI in the Casper CF study can be summarised by 3 key pillars. So while we do our work, our aim is to educate patients and the public on the aims of the study. So really make it applicable and accessible to anyone who is interested. To advocate for patients within the design and delivery of the study, and then to disseminate the progress and the results of the study throughout. Again, trying to really make it as accessible as possible for everyone who's interested. We have a number of methods to complete these aims. So we use a steering committee, which I am part of, and also has a number of patient representatives, as well as people within the study team. I have been using focus groups. So these are smaller groups looking at actual individual pieces of trial material and basically really involving patients in those areas. We've also had a large campaign to develop accessible trial materials. So, as I say, just really opening it up to anyone who could and would be interested in this to know what we're doing. We've been using social media as a tool to engage people and get people involved. And we've also, I also sit on the study team meetings, which is, yeah, a real privilege to be involved in that area as well. Thank you. Next slide, please. And these aims and these methods come together to form a number of outcomes. So these outcomes we've so far, and we've only been doing this for about 1.5 years, we've created a lay protocol, which is basically a protocol in kind of common terms for people to understand, which is great. We've also turned those into graphics, which we then intend to kind of disseminate and tweet out to people. We've also got a Twitter account, which is really helpful. And as I said at the bottom, do encourage you to follow that and see what we're up to. We've created a YouTube video explaining what we're doing. We had a huge amount of input and review onto our protocol design when we wrote that. And we will also be considering the effects of COVID-19, which I'm sure for all of you is a huge part of what you do at the moment. So we have a real commitment to involve patients at the heart of what we do while we reconsider that and how that's going to affect our trial. And finally, we disseminate the results and our progress of the study as we move on. So thank you. I think that's all from me.